So I just want to start off by welcoming everyone to week 4 of Waves of Wellness. And it's really exciting to have Dr. Gloria now as part of admin. And so she will be on this call regularly. And Cynthia basically said, I said, well, how do you want to handle this? What do you want her to do? And she's like, well, I want her to be your Ed McMahon. So I am pretty excited about that. It sounds like a really fun role. And so this is week 4 that we've done of Waves of Wellness. And we have had 3 weeks of vision statement, of lymphatic health, as well as gut health. So if you haven't seen those, you can watch the replays. But today we're going to watch something really special about a silent epidemic, Candida, that is in most people. But first we have a disclaimer. The information provided is not meant in any way to diagnose, treat, cure, or be a substitute for medical care. If you have concerns regarding dietary modifications or any information provided, see a medically licensed doctor of your choice, preferably a nutritionally aware integrative medical physician. The information Dr. Gloria is providing is gathered from more than 40 years of personal clinical experience and education and is shared as health through education. So that is our disclaimer. And I also want to read, in case you missed it, is Dr. Gloria's like short little bio. Okay.
Make it short.
I will make it short. But I just want people to know. And we didn't do that last time. So I think it's really important. So Dr. Gloria is a CDP, ND, DA, HOM, PhD, DSC, food eco-ergonomist, holistic rejuvenist, HTMA certified practitioner, professor of natural health, specialist in quantum frequency full body scans, the founder and executive chef, the anti-inflammatory Culinary Institute of Nutrition, author of 28 natural health books, the publisher and author for 32 authors in scientific research, over 56, is it 56? 100 natural health and research articles. Wow.
Yep.
That's
why I said make it short.
Well, I did the best I could. It's hard to be short when it comes to all that. And for those that don't know, I am a holistic health coach, a personal trainer, a sports nutritionist, and a Reiki master, which is essentially Japanese energy work. So we come to you because we love you and because we love helping people improve their lives through healthy habits and lifestyle practices that one of my taglines was lasting lifestyle changes. We don't want to focus on quick fixes. We want to do things repeatedly so that they compound and become second nature for you. So today, Dr. Gloria is going to teach you about Candida and how it is hurting your body. She's going to cover a simple test on how you can see for yourself if you have it in your body, as well as a couple things that you can do to help yourself with that. So go ahead, take it away.
Great. Thank you, everybody, as well. Candida is one of those things that you never hear about in conventional medicine. You leave the country, you leave the US, and the integrative medical doctors I've researched and worked with start out with how many carbs and how many sugars are you eating? Because they know that that is what feeds Candida. Or the next question is, how many antibiotics have you had and when was the last round? Why? Because it feeds Candida. But other than getting a vaginal yeast infection or a UTI of any type, doctors don't talk about excessive Candida, even if they talk about it then. So first of all, I want to clarify a couple of things that are asked constantly by my patients. Like patients will say, is Candida the same as H. pylori? If any of you have had H. pylori, you know how painful it is. H. pylori occurs in the stomach, and it's a bacteria. It's not a fungus. So researchers aren't even sure when people say, well, okay, so it's a fungus. It's a bacteria. But how does it spread? Well, it spreads by unclean food. That's why we get a lot of food poisoning when we're in an area, for instance, a developing country, because you don't know who washed the vegetables. You don't know how everything was cooked. et cetera, et cetera. And it's also in the water systems in many developing countries until now. Now we're seeing all of those same H. pylori, parasite infestations, all of that in the US. Why? Because we're so international. We're all traveling so much that we're bringing things back to this country that we never saw before. So people then say, okay, so it's not the same. It's a bacteria. It's not a fungus. So can it be transmitted? If you have it in your stomach, yes, it can be transmitted by any body fluids, kissing, any other kind of personal contact. But it usually causes a peptic ulcer. So when you get a diagnosis of H. pylori, you usually get a diagnosis of an ulcer. Okay, that's pain in your stomach when you eat, but especially when you don't eat, when your stomach is empty. And many times people mistake it as Candida, or you hear the term leaky gut, which I almost died from. But that doesn't happen in the stomach. Remember that. That's incorrectly described. Candida doesn't usually affect the stomach in any way, except in extreme cases when it's called sepsis. All of you in the healthcare industry know what that is. And I have a very dear friend that passed away from that. And so sepsis is definitely not leaky gut. Okay? Leaky gut occurs in the lower GI. You want to say your small and large intestine, or if you want to call the large intestine your colon. And it's literally scientifically documented now that your second brain is in your gut, not your stomach where H. pylori grows and causes problems. Your second brain is in your gut, which is your small and large intestine, which is also where leaky gut occurs, not the stomach. The stomach will only leak out if you have excessive Candida to the point where it's in the stomach and it also has H. pylori. And I've seen that happen, not very often, but I've seen it happen. So then the next question is, okay, so what are the main causes of Candida? Well, antibiotics is number one. Steroids. People don't realize that steroids do as much damage to the good bacteria in your lower GI, in your gut. When I say gut, I mean small and large intestine. Remember that. And they don't realize that steroids do as much damage as antibiotics. Yes, antibiotics save lives. I'm not saying they don't, but that should be as a last resort in a very serious condition, not as the first line of approach if you have an earache or a UTI because you're causing more problems. Another thing that causes a lot of Candida, and I can speak from personal experience in my 20s, it was awful, is oral contraceptives. I was on birth control pills for many years. And any medicines that cause an extremely dry mouth, because that's a great breeding ground for bacteria, okay? Or medicines that turn off the healthy bacteria, meaning, again, back to steroids and back to antibiotics, especially, those two especially. So what else causes it? Well, this is the biggie. If you have Candida, and you will see how you can test yourself, and mind you, when I was in Ecuador, those 3 years teaching and researching, the MDs that I work with do the same test that I'm going to show you how to do today. They don't send you to the lab for lab work for a urine or blood analysis. They say, okay, you're going to do this, and you're going to send me the results. And then I'll tell you what to do about it. And when that happens, you unequivocally can see what you have to do to change. It's not like you're looking at it, just like I said about Darlene's test. The reason they're so valuable is people see that color. Remember, I mentioned that. If you see a blood test and it gives you a number, okay, it's a number, I'm out of range. But when you see the scans that Darlene does, for instance, and you see that big red line, it's like, oh my God, this is really serious. Same thing with this. When you see that test, you're going to go, oh my God, right, Tracee? We've talked about this.
Mm-hmm.
It's mind-boggling to see the reality. So whether it's in color or whether it's something that is a visual, it really, really lets you know where your body is. Blood test and urinalysis is not going to do that unless you have sepsis. And when my friend passed, there was nothing they could do. By the time they got her to me, she lasted, I don't know, 3 or 4 days in intensive care and passed. And she was in her 60s.
So let me ask you, is sepsis a form of Candida?
Yes, that's exactly what, that's a good question. Yes, yes. And when sepsis is diagnosed, it's serious. You're on your way out because the body is completely overtaken by fungus. And so what they do is they give you antibiotics, which is what happened to my friend. And so the important thing is now you know what feeds it as far as medications, for instance. What feeds it as far as food? Only two things. Only two things. Simple carbohydrates that convert to sugar and sugar. And you've all heard, and I'm going to do a presentation shortly in a few weeks on just sugar. And I hope that I'm going to give you some details that you haven't heard before, because we all know sugar's bad for us. But those are the two things. Remember, simple carbohydrates and sugar.
So why don't you explain what simple carbohydrates are in case they don't know?
Okay, good point. Anything that converts to sugar is usually a grain. So if you're eating bread, people think, oh, Dr. Gloria, she told me not to eat gluten, to stay off gluten. So they buy gluten-free bread, but they're still feeding Candida because it's a grain. If you're eating lentils, split peas, yes, Kelly's shaking her head, yes. If you're eating lentils, split peas, that type of thing, no, that's not going to feed Candida. But if you're having bread of any kind, and I only eat gluten-free, and I'm type 2 diabetic, and it spikes my blood sugar, so I can only have a slice maybe once a week. I mean, it's that serious. So when you have Candida, and you've tested and convinced yourself that you have it by looking at the results, okay, you have to remember that you should eat like a diabetic. That's the easiest way to tell you. If you're diabetic, you watch the simple carbs because they convert to sugar, and you don't eat sugar. So then the next thing is, okay, and Tracee, I think do you use monk fruit or stevia?
I use monk fruit.
Okay, so do you, have you explained the difference between stevia and monk fruit? Or should
No. Go
I
ahead.
get that question asked a lot. Monk fruit is a type of a lohan, which is an Asian gourd. Just think of it as a small football. And if you look online, you'll see what it looks like. And the inside is the meat of it, the pulp of it is very, very sweet. And they grind that, they purify it, and that's monk fruit. It's granulated so that you can bake with it. That's what I use for baking. But stevia is not a gourd, it's a leaf. It looks like mint. And in South America, I had it growing in my yard. Here, I've tried to grow it and it just dies on me because it's got to be a different climate. We're just not able to grow it well in the United States unless you have a very, very good greenhouse, okay? Temperature controlled, perfect humidity, the whole bit. But it's a leaf. And if you take the leaf, let's see where my hand is here. If you take the leaf and you just go like that and rub it between your fingers and taste it, it is so sweet you can hardly stand it. That's the same thing as if you were to grind that gourd of monk fruit. So I recommend using monk fruit when you're baking because you need that bulk. You know, like if you had brown sugar in a recipe, it's not going to work as well if you try to put liquid stevia. But I don't have anything to do with the store, but I'm going to tell you that the only stevia that I like, and I've tried probably 15 brands, is the liquid stevia from Trader Joe's. To me, it's the best. I hope they never go out of business. They make their own, they have their own brand of stevia liquid. They also have a powder, but it's a little bitter. The liquid, I can't detect that it's not sugar, okay? So I use that in everything, including my nice, wonderful golden milks that Tracee, I was telling Tracee just the other day that I've given her recipe, and with full credit, this is Tracee's golden milk from my team to my patients because I had a recipe for years and loved it. And it doesn't have sugar. That's why I'm telling you. Yeah, thank you. And Tracee's is 20 times better than mine. So I've adapted it just to add my whey protein and some other things because it doesn't have sugar. So if any of you haven't tried Tracee's recipe for golden milk, you need to, because my patients are saying, you know, I have one problem with it. A lady just told me that on Monday. And I said, well, what's the matter? Are you getting GI issues? No. She says, I'm addicted. I don't want just one. She says, I make 2 or 3 a day and I've lost weight. And I said, how's your blood sugar? Oh, it's down quite a bit because there's no sugar in it. It's all spices, it's all almond milk or coconut milk, and you don't have anything in it that's got sugar. You're not going to feed Candida. So remember, if you're feeding Candida, then you're having the diet that a diabetic should not have. Okay.
Okay, so let's stop. Let's talk about that really quick. So
okay.
rice, potatoes,
even sweet potatoes.
Okay, so yeah, but I was just saying rice and potatoes, they digest down into sugar.
Yes. Yes.
Okay.
The difference is, that's a good point, Tracee. The difference is, like a sweet potato, I only eat, because I don't eat nightshades, I only eat white sweet potatoes or orange ones, okay, or purple when I can get them. Those still have a high carbohydrate content, but it's a slow release of carbs, so it doesn't affect the blood sugar as much, and it doesn't feed Candida as much. But you don't eat a whole potato. You eat small portions. But yes, and then when you have stress, what happens? We want to eat, right? It's that comfort feeling. It's that internal hug. So what happens? We usually go for something that is sugary or something that is carbohydrate. One question that I ask, and Tracee, you and I haven't discussed this, so I don't know if this is something that you've discussed in the past. When we tell people that we have yeast, basically fungus, Candida, the first question that comes up is, what about brewer's yeast? Have you used brewer's yeast in your cooking or baking?
No, never do.
I was hesitant until I saw all the research when I was in Ecuador. They recommended a lot because it's very, very high in iron. It's very high in vitamin Bs. But brewer's yeast is not going to feed Candida, and it's not going to hurt a diabetic. The reason that I learned about it was I went to a doctor's meeting and they served popcorn. And I said, oh God, that's really going to sabotage me. I love popcorn, but to eat popcorn, I got to have cheese on it. And they brought brewer's yeast, put it on the conference table. None of the doctors eat cheese. They're all sensitive to dairy. And they just sprinkled it all over my little plate of popcorn, and it was fabulous. So I use it in soups. I just made a broccoli soup the other day, and I don't want to have broccoli cheese because I don't want all that dairy. And it tasted just like cheese. So don't be afraid to use that. It does not feed Candida. Okay. And yes, I have a recipe for it, which we can figure out how to share it. But it was a delicious broccoli cream cheese soup without the cheese. It was a mock cheese soup. So don't worry about brewer's yeast. It's very high in vitamin Bs. And with all of our stress that's going on in the world right now, we can all use some help with the stress. With all those vitamins that are nutrition based instead of a supplement, we're going to help our adrenals to deal with stress better. Now, the other thing that happens is when you have an immune deficiency disorder, for instance, HIV or cancer or rheumatoid arthritis, usually the base of it is Candida. And the only way you'll know is by doing the test yourself. A blood test and a urine test is not going to identify it until it becomes, remember this, until it becomes systemic. Then it's diagnosed as sepsis. And that happened a lot when I worked for the Catholic hospitals and was in charge of the dietary programs for the patients in long-term care or assisted living. They all had Candida. Why? Because the diet was bread and potatoes, because that's what the older people wanted. And Kelly's shaking her head. This is what people wanted. And I had to change all that. Yes, you can give them a sweet potato. They all had inflammation. You can't do that. You've got to watch what is feeding the yeast, because that was blood sugar, blood pressure, depression, all of it. It affects every part of it. So in the gut, remember, it can quickly spread to your entire body. And what are those symptoms? Headaches, brain fog. I have a younger son who's in his 50s now. I can't even believe that I'm saying that's the age he is, who suffered from terrible depression. I was divorced when the boys were little, and he, blamed the whole world for everything. He was always a victim and depressed and in counseling and in therapy, and he wouldn't change his diet. And I kept saying, you have Candida. Finally, one day when he went to visit me at my farm in Idaho, he agreed to do the test that I'm going to show you, and he freaked out. He went completely off the carbs and sugars for about 2 months. His disposition changed. Even his girlfriend, who later became his wife, said, I've got a new husband. I've got a new boyfriend here, a new fiance. Fiance, that's what she was at the time. Because he was calmer. He wasn't out to be a victim. So it does affect your brain in many, many ways. Brain fog is one of the first manifestations. Depression then follows after that, or anxiety and panic attacks. Usually it's because of too much of the fungus. Of course, we know UTIs. I just mentioned that. Sinus and ear infections. And my son, not knowing, I was working in dentistry at the time when he was little. I didn't know that he shouldn't get an antibiotic every time he got these terrible ear infections. I mean, every month he had an ear infection. Well, now I know it's because what he was being fed. But they gave him an antibiotic, and sure enough, 6 to 8 weeks later, he had another infection. So it's very important that you understand that it's not just the food. The antibiotics will do it, but if you continue to eat the wrong food, it continues to feed the Candida. Candida is always in our body. We get it through the vaginal tract when we're born. It's a natural part of the microorganisms in our body. It's when they become excessive that it's dangerous, okay? And when Candida's in the mouth, remember, what happens in your mouth happens in your body. And again, I'm unfortunately the example of that. I had a terrible infection and had to have a lot of extractions because of that. And here's the shocking part, I think. It's the fourth most common source of hospital-acquired infection. Candida is the #1 most common opportunistic infection. And anybody with a lowered immune system, HIV positive, and especially people in senior care centers or in any kind of an assisted living center where somebody else is feeding them, okay? Somebody else is making their food. It's a yeast in a whole unique form. It's found in the vaginal walls and the intestinal digestive tract. That's what I'm saying again. It's not in the stomach. It's in the gut. It's only in the stomach when it becomes excessive, okay? And it's dangerous because it does cause serious neurological issues. Not only that, Tracee, you and I briefly discussed the fact that one thing that is a little controversial, but I'm glad to see a lot of men in the audience today. Most men don't know that prostate issues, prostate cancer, prostate inflammation is based on excessive Candida. And Tracee, I believe you did a link, didn't you, for the book that I mentioned?
Did you do a link for the book that you mentioned?
Yeah, it's on Amazon that I sent you this morning.
Oh, I didn't see it.
Okay.
Did you email it to me?
No, I WhatsApped it.
Okay, I'll find it.
Okay, but the name of the book is The Great, I think it's The Great Prostate Hoax. And it's available on Amazon. I don't know the author, but it's so well referenced that I made every patient of mine that had a diagnosis of a prostate problem buy the book and read it before I'd even start helping them when I had my clinics. The doctor and the scientist that wrote this book have so many references to prove to you how the PSA test was created.
Did she freeze? Uh-oh,
yes,
Kelly, she froze?
Me, but I don't hear her either.
Well, here's the link for the book. And
oh, you found it? Okay.
Yeah. It was on what? Video.
Where do you post it? Oh, there it is.
I post it in the chat.
It's called oh, good. I see it. Yeah, it's The Great Prostate Hoax. It's been republished several times, but it's a fabulous book. If you have any questions, all the references are there about the studies, all the scientific proof you could want. But the basis of it is prostate issues, prostate cancer, prostate high PSAs are basically an excessive amount of Candida yeast, the fungus that's in their body. So yes, you can go ahead and try alternatives without having to go and agree to be, cut on, for lack of a better word. And it's frightening. I mean, most men end up with some kind of a prostate issue, and not only as we get older. I have a lot of 20 and 30-year-olds. Why? Because their diet is contributing to their prostate issues. So it's dangerous. It's dangerous because it escalates. It's dangerous because it's, let's see, because your immune system is sabotaged every time. Every time. And when your body's natural pH is out of balance, it also helps the Candida to multiply. So like when I work with patients, they've got to take their urine pH. They've got to put their little strips under their pee one time a week and send me the results. I don't want to see their strips. You should see, it's kind of funny. Sometimes people send me pictures of their strips, and I just want to know what the number is. But when they're on a protocol of 120 days, for instance, when I'm working with them, they have to do it every week. Why? Because a picture is worth 1,000 words again. When they see that, oh no, I think I'm okay, I'm having an alkaline drink and I'm adding this to my smoothie in the morning, I should be fine, and their pH is 6.0 when it should be 7.5 average, they realize why they have Candida. Because in an alkaline environment, Candida, even cancer, cannot survive. And when you have Candida, it can grow faster and multiply much quicker. I think you have a slide on what Candida looks like. Is this appropriate time to show it, Tracee?
Yes, I'll show that. And then while I'm showing it,
one if you can.
Okay, so I'm on the other one. Let me go back. Let me explain something else to the listeners, is that I have been on a low carb ketogenic diet for 7 years. Like I never eat. I mean, my diet consists of vegetables, healthy proteins, a little bit of extra fat, like coconut oil, olive oil, avocado. I don't do hardly any dairy, but I don't eat sugar. I mean, I'll have berries on my yogurt, but not that many, and maybe an apple here and there. But I did the test that she's going to show, and I came up positive, which I was shocked. I was so shocked. So let me show you what it looks like. Okay, can you see that?
Yeah, you want to get rid of the other slides so we don't have the other slide showing? Can you close them?
I don't know how to do that.
Thought you were okay. I thought you okay. That's okay. Ignore the other slides. I call this particular organism the tinker toy, because look at how it replicates. You see the little, you see the main part of it, right? Then you see the light lavender stems that come out. Okay, they're called hypae. And what happens is every time you see those little eyes, you see the little eyeballs that look like eyeballs, that is where another one comes out. So it's like a tinker toy. Every time one grows, as that one wants to multiply, another little eye appears, another tinker toy comes out, and that's how it continues to grow. So when you add sugar or a carbohydrate that converts to sugar to this, you're literally adding fuel to the fire, because you've already got all of this prolific explosion of fungus. That's pretty disgusting, isn't it? When you look at how it's exploding. Okay, so okay, Tracee, let's get that off if we can, please. And don't show the others yet until I discuss them. So anybody have any comment on that? Did any of you ever see Candida pictured that way? That's a hard slide to get. I got that from a laboratory, and it
looks like an alien.
Books that I've written. It does look like an alien, especially when you look at those big eyeballs. But that's where it grows another one, and then that one continues to grow, and it gets mature, and it grows another one, and that's why it can wrap around the brain. It can wrap around all of the interior of your intestines. It can wrap around your eyes. I had a patient that had gunk coming out of her eyes. Nobody could figure out why. Went to every specialist. They gave her prescription eye drops. They gave her antibiotics. I told her which eye drops to buy that were natural to see if it would help. Nothing helped. When she did the saliva test, finally, because she didn't want to do it, then I just gave it away. It's a saliva test. When she did it, she freaked out. She realized why her eyes were literally weeping, because it was getting just like many people do with the devices, the black and the white device. They start getting discharge out of their eyes because the body is detoxifying. In their case, the body was trying to get rid of some of that yeast that had already infiltrated their eyes. Now, I get asked, can that cause cataracts? I don't know. I really don't. I haven't researched that. But I do know that it causes probably 90% of the disorders with the people that I work with around the world. It's that invasive. So let's, where do you want to go now, Tracee? Bring in some.
Well, I know they have a lot of questions, but I'd rather like finish this up and then talk about all the questions.
Okay.
And so you show the test, and then I'll cover the recommendations on how to get rid of it. Since, you know, we discussed that.
And I can expand on that. Yes.
Yeah. So let's go to
because there's only one supplement that I know of. So she'll discuss that with us. Okay. So you're going to do the test.
Here we are.
Okay. This is how you do the test. You get a glass of water before you go to bed, a small one, and don't get one with a fancy, you know, lead crystal carving. Get a plain. I bought mine literally at the dollar store because I wanted just a tumbler that had, you know, clear glass so that you can really see what's going on. Put the glass of water on your night table or in your bathroom. And first thing in the morning, before you do anything, don't drink water, don't brush your teeth, collect as much saliva as you can. This is done in other countries. This is what the doctor would tell you to do. Collect as much saliva as you can and spit into the glass. Doesn't cost you anything. You're not going to a lab and spending a bunch of money. And let it sit for 2 minutes. And it says take a photo because this is taken from a presentation I teach from. So my patients take a photo from the side, just like you're looking at the glass now, and send it to me when they're on a protocol because I need to see what's going on. When you see the strings, well, no, let me backtrack a little bit. If your saliva just floats in the top, you don't have any Candida that's excessive. You have just what the body has in a normal way. If it floats, there's no Candida that's excessive. If it starts getting strings that look like little legs coming down, or like rain coming down out of a cloud, you've got Candida. If it's cloudy specks, you've got Candida. And if it sinks right to the bottom, you've got it excessively. And I have pictures of a patient, 2 patients actually, to show you what it looks like. And we can go back to this if we need to. Can you show the 2 pictures of I think it's the next slide, Tracee, of the actual patients? Okay, see what I mean by taking a picture from the side? Look at the one on the left. That is extremely heavy. That's a stage 4. It's rated 1 to 5. So you can see that after 2 minutes, she started having legs come down, but then a big clump. It was so heavy that it took enough weight in the water for it to start coming down. But look at the right one. That's a tornado. That's what we call a tornado. It's that excessive, and that woman has cancer. Does that tell you anything? The woman on the left has fibromyalgia. The one on the right has breast cancer. It's an invasive fungus. If you learn nothing else about how to test and how to take charge of your own health, learn how to control Candida, how to identify it and how to control it. This is the test that Tracee did. Yeah, that she was so surprised because she's so healthy and she does all the right things. But Candida hides. Every patient that had fibromyalgia that I work with, and I was president of the International Association of Fibromyalgia for, I don't know, 9-10 years, lost track. And every one of them had Candida. And they were only fibromyalgia and chronic fatigue patients that attended our conferences and were members. And it was horrible because nobody believed it. And I just finally got glasses, literally bought them at a Goodwill store. They had a big box somebody had donated, I think from a bar that went out of business or something. And I bought them all and took them to the summit when I was lecturing and had them all do it. And they were like freaking out. And this wasn't first thing in the morning. This was afterwards. So first thing in the morning is the best indication of what you have. Doesn't cost you anything. It costs you a little bit of effort. And it's the most important thing you can do for yourself. And I call it health through education. Because if you didn't know this, how are you going to be able to prevent it or get rid of it? And for you men, please buy the book and read it. Don't take my word for it. It's full of scientific references. It's easy to read. There's a little bit of text in there that's a little bit scientific, but the rest of it is easy to understand. And it'll tell you who developed the PSA test and why it's not effective. It was not developed to identify cancer. It was developed for other reasons. And please, if you have any questions and you doubt what I'm saying, read the book. It's worth it.
And
okay,
Brian posted a YouTube link, I guess, where maybe the author is doing a lecture or something. So that's in the chat. They can check that out. So now you know what the problem is. You know the biggest problem, right? We want to kill Candida in our body. So the first thing you want to do is avoid carbs and sugar. And I'll get to the question, well, what do I eat in a minute? And then there's also, you want to reduce your.
Whoops.
To begin.
If you can hear me,
another video.
There you go. You're freezing out. Yeah, you're freezing. Okay.
I am.
Yeah, you froze out for a minute. You're okay now.
Okay. So I said, it's stress. You want to get rid of stress. So the first thing you want to do is remove yourself from stressful situations. And then after that, you want to manage the stress that you cannot remove yourself from by finding relaxing practices, whatever it is with you. And then there's some supplements and foods that you can take, such as caprylic acid. Pure encapsulations makes the highest quality one. And you want to take about 800 milligrams a day. If you have big or like a lot of Candida, if you just have a little bit, then you want to do it every other day. And also vitamin C, 400 milligrams of high quality professional vitamin C powder. Organic coconut oil, 2 tablespoons a day. You can put it in your coffee, put it in the blender, whip it up. It's all frothy like a latte. Don't do it all at once, though. You might have some GI distress. So you want to kind of spread your coconut oil intake throughout the day. And just make sure you're getting plenty of water. I like drinking out of these big jars because I can drink more.
And
the straw likes the straw. I don't like the lines that straws have given me in the past. I've never smoked, but I have these stupid lines on my face. So I like drinking out of that, but just find the way that you will drink more water. I drink a gallon a day. And getting back to the carbs and sugar, somebody in the chat asked, like, well, what do I eat for carbs? Well, let me tell you, I'm an athlete and you do not need carbohydrates. Okay. Now, if you're going to choose to eat them, my favorite carbs would be sweet potatoes. And I do eat butternut squash. I do eat squashes. Also lentils are a good choice. You can have, any type of like a bean, like a legume. White bean soups are okay, but those are like a better choice. So sweet potatoes, lentils. I do not eat any rice, bread, or pasta. If I want a sort of a pasta, I will use I'll either use zoodles, which is usually what I do is I make zucchini, or I'll do, palmini. It's a hearts of palm pasta. I don't know if you've seen those before. I've made lasagna with those, but really, truly, pasta just tastes like the sauce that you put on it. So spaghetti squash is something else I really like. And put like a red sauce on that. I know Dr. G doesn't like red sauces, but you can do pesto or whatever. But I have lived this way, you guys, since 2016, where I don't eat any of that. And so last night for dinner, I had barbecued chicken I had roasted carrots, butternut squash, and leeks. And then I made a homemade dressing with apple cider vinegar, olive oil, and shallots and Dijon and some garlic. And it was delicious. So we don't need carbohydrates. That is just like the food pyramid, I believe, is upside down. So I don't do any cereal or anything. Okay, how do you spell this supplement? I'll go ahead and put that in the chat so you guys can
Tracee,
see
if you want to spell it, and then can I tell them what it comes from? Because there is something they need to be aware of.
Yes, go ahead.
On the supplement. Yeah, caprylic acid, and she just put it on there, CAPRYLIC, is a totally natural food-based supplement made out of coconut. It's made from the inside of the coconut shell. And so we don't grow coconuts for that in the United States. So it's all imported. And when COVID hit, it was very hard to find because the ships weren't coming in. Nobody could get the raw materials to make it. It is the most effective thing I have ever found to weaken the membrane, that shell that's on the outside of the fungus. And the way that I describe it is that think of a thick-skinned grapefruit, for instance. The caprylic acid is like, and the way the doctors explained it to me, is like poking holes in it, like poking a pencil or taking a pick. And all of a sudden then, the caprylic acid weakens that membrane. And by you changing your diet, they die. You've now added oxygen to a cell that is completely encapsulated, and therefore it starts dying. But 2 warnings. If you're allergic to coconut, don't try it, even though it's inside the shell, part of the coconut. The second thing is that, just like we've talked about, and Tracee, you've mentioned this, and I know that everybody on the chat has, and Cynthia has, you can have an allergic reaction called Herxheimer reaction, or an allergic response, if you kill that fungus too quick, because you're dumping toxins into the liver faster than the liver's ability to neutralize them. And that's why we get a Herxheimer reaction.
So let me ask you a question about
that you do it slow.
Can you take a binder? So can you take a binder such as like bentonite clay or activated charcoal, so that as your body's killing off the Candida, it can bind into one of those binders and eliminate, instead of having the Herxheimer?
That's a great comment. Yes, you can do that. But I have found people still can get a Herxheimer, because what happens with the binders is sometimes they get constipated, or their bowel elimination slows down. Well, that's the last thing we want. You want to stay hydrated, and you want to make sure you have good, full, and complete daily bowel eliminations, because you're killing something that needs to be taken out of the body, and we don't want it to stay in the colon and recirculate.
So what's your favorite tip? What's your favorite tip for elimination then, if people feel like they're getting, they're having that problem?
Slippery elm is really good, and it's easy to get. But I think that the most important thing is make sure that you drink plenty of water and have fiber. If we're only living on green drinks, like some people do, they want to lose weight, they don't want to eat a lot, they don't have enough fiber. Like what you were describing, Tracee, last night, you had a lot of fiber in that meal. You know, whether it's squash or whether it's green salads or carrots or sweet potatoes, that all has great fiber. You don't have to go buy a fiber supplement in most cases. There are cases where you have to get a natural, organic stool softener, but you don't really need to go spend money on a fiber. I know I used to formulate products for nutraceutical companies, and all it is fiber from food that they dehydrate and run it through a machine, put it in a capsule, and you're paying big bucks for it. You don't need to do that, but you have to add fiber. You can't assume that you can just throw it in your Vitamix and you're going to get fiber because you got carrots and celery and, whatever. You have to have the fiber. So remember that. And if you have a juicer that extracts I don't like those for other reasons, but if you have a juicer that extracts the pulp from the juice, that is not going to help you, because the fiber is being lost. I used to compost it. I didn't know better. That's when I first got my organic farm. And I would throw all that good stuff in the compost pile and drink the juice. Well, it doesn't give you the fiber. And so you need the fiber. But what Tracee was saying is great. The sweet potatoes, carrots, I mean, even though carrots have natural sugar, as long as you're not excessively eating them, they're fabulous. They're great fiber. Celery, cucumbers, make your salads with cucumbers, for instance. And you were mentioning about pasta. I don't eat pasta anymore either. I make zoodles. I have a zoodle machine that makes it out of the zucchinis. I make lasagna. I have all these recipes. That's why I'm going to start a cooking institute. But I thin with a mandolin, slice the zucchini real thin, and then layer it and put in all your sauces in between and your cheeses or whatever you want, your herbs. And it tastes just as good, because Tracee's right. It's not the pasta that has a lot of flavor. It's what you put on it. Yeah. And we're also used to, I love spaghetti. Well, yeah, but you would love it just as much if the sauce was the same and you had it on something that was a vegetable.
Right. Okay, Tracee, so Arison has had his hand up for a long time. Do you want to take a few questions first?
Yeah, go ahead.
Okay, Arison, go ahead.
I heard you say that you were a diabetic. I'm not a diabetic, but I have neuropathy in my feet. I worked on concrete for a long time. And I'm wondering, can you, Candida, could that cause that, or sugar? How can you take care of that without getting, I take gabapentin to help the burning and everything. And I'm just wondering about
and the numbness. Sure.
Yeah.
Yeah. No, I can't give you medical advice. I can tell you what I do. Okay. Let's verse it that way. Yes, to answer your question, Candida can cause that. But when there's nerve damage, you were on concrete. That wasn't my thing. I didn't have neuropathy till I became type 2 diabetic after my accident. So what really helps in most cases is to make sure that you get plenty of food that's anti-inflammatory by changing your diet. I'll tell you what I take, and I take a lot of omegas, a lot of fish oils, because that's an anti-inflammatory, and make sure that you hydrate well, because men are not good about hydrating. You may be the exception, but men are not good about hydrating. And if you do that and have a lot of good, healthy fish, like a lot of good, Tracee's had this conversation before, the good salmon, have some good cold water fish, you're going to start helping the neuropathy, because that helps the inflammation go down so the nerves can repair. Okay, so get rid of the Candida by changing your diet, and then supplement with some good fish oils so that reduces the inflammation that's already there, and the nerves have a chance to heal. They can't heal when they're inflamed. Okay, thank you for the question. That was a good question.
And Arison, the golden milk will help you because it has turmeric, ginger, cinnamon, cloves. I mean, it's really anti-inflammatory. So, and I also would recommend, if somebody has any neuropathy, to go to a chiropractor, because that could be a big thing, especially because if you've been on concrete for a long time, you could have a lot of impacted vertebrae, which could be pinching and causing the problem. And I'll tell you a quick little story. So I went to my chiropractor. I go every Thursday morning. And he was talking about a new patient of his that their family had a car accident. And the baby at the time was 8 months old and was babbling just like a little 8-month-old baby. But after the car accident, he didn't make another sound. He stopped talking. He stopped babbling.
Wow.
And he went to my chiropractor, and when he came in for the third visit, so he'd only had 2 adjustments, he was babbling again. So chiropractors are so effective with helping things that people don't even realize. They study the full anatomy just like a medical doctor does, but instead of studying pharmaceuticals, they go a different direction and they study holistic practices and adjustments, techniques. So I encourage everybody.
You're absolutely right.
Chiropractic.
Well, and Tracee, to your point, very well taken. Usually, if it's not diabetic related or related to a drug, for instance, that caused that as a side effect, it could be lower back. Usually I find when it is, it's sciatica. It's a lower back problem from standing. I have that a lot with people that are checkers at a grocery store, for 20 years. They have neuropathy, but the problem is in their lower back. So you're absolutely right on. So if you can go and get a chiropractor to consider that and tell them what's going on, it may help you. Thank you. That's a good question. You have some other hands up.
Yeah, Cheryl, go ahead.
A couple of questions, but first I wanted to just ask about the yeast. You had mentioned brewer's yeast. Mm-hmm. Can nutritional yeast substitute for that or not?
Yes.
Okay.
It's just a different name for it.
Okay.
Different name. That's a good question. Thank you for bringing that up. Yeah.
Great.
Good question.
And then secondarily, when you were talking about the protocol for the glass of water and then spitting, I drink kind of water sipping and swallowing through the night because I wake up and periodically and, my mouth is dry, etc. Do I have to stop doing that in the night to do the test?
You know what? Not necessarily, but it would be a much more valid test If you could take a big glass of water before you go to bed and not take any that night, you only have to do it once a week. Don't do it every day anyway. It would be, Cheryl, it would be more valuable for you to get a true picture if you just avoided it during the night.
Okay.
But
Thank
again,
you.
that's a good question. Yeah. You're welcome. Next one.
Okay, Rich.
Where's Rich? I'm trying to find him.
He's in the upper left corner.
Oh, I see you. Rich, go ahead.
You have to
Unmute.
unmute. There you
Am
go.
am I unmuted?
Yes.
Oh, okay.
Yes.
Yeah. This is very interesting. I wanted to run three different things by you, Dr. Gloria. Have you heard of homeopathic Candida?
Yes, of course. I'm a homeopath. Yeah.
What do you think of that?
Yes.
That approach? How would you use
Homeopathic is fine. How would you use it? It's
no, well, what I mean is how effective do you think that is in preventing or even curing the Candida?
That's a great question, Rich. In preventing it and being proactive, we can't say preventing, but in being proactive, it works once the Candida is under control. But in order to kill the Candida, no, because the dietary changes have to take effect first. I would use the caprylic acid in order to be able to kill it. Then, yes, to your question, it absolutely can keep it down. Absolutely. That's a good question.
The other question around that is there's different potencies. There's low, and very high potencies. From
okay, I can't give you medical advice, but I can tell you what that is. And again, that's a good question. Thank you.
Would it be
most people
higher,
don't understand homeopathy.
Would you say it'd be a higher?
Yeah.
A higher one?
Yeah.
Than
Let me answer that.
Okay.
Yeah, let me answer that, Rich, because most people don't understand. Thank you for bringing that up. All low potencies, and you shouldn't try to play doctor, but all low potencies in homeopathy are for something that just happened. You sprained your ankle, but you haven't had an injury before. You've got an allergy attack. All of that is low potencies. When you have a chronic condition, you've had shoulder surgery, you've got a bad shoulder, you've got bursitis, you use a higher potency, which is only available through prescription. For instance, I have to write that prescription for the Institute to fill it. You can't just buy it if you're a patient of mine.
You can get,
but the lower potencies, sometimes you can, yes, depending on the formula. And then the lower potencies were all being carried like at Whole Foods and all that, and the FDA just took them off. So if you'll notice, Whole Foods took all of their homeopathics off the shelf. So that's coming because we all know why that are on this call. So I think they're going to disappear more and more. So I have advised my patients to stock up on anything that they use regularly in homeopathics. God willing, it'll come back when all this is settled and our country's head is screwed back on straight. But for right now, that's about all the advice I can give you, because that would be giving you specific advice. And it depends on what your condition is and how long you've had it and what brought it on. So I can't get any more specific than that.
You can buy homeopathics from the laboratory that produces them, and I used to work there too. It's up in.
Okay, well, if you can buy them, more power to you, as long as you know how to use them.
Yeah, I'll do. Yeah. Okay. Two other things I wanted to ask you. What about the emotional aspect to Candida? What I come up with Candida, it's a lack of love for oneself, and this particular condition is trying to compensate for your own lack of love for yourself. What do you think of that particular approach?
I've heard that approach, Rich, and that's interesting that you'd ask that, because in Ayurvedic and Chinese medicine, they don't attribute it to that. They attribute diabetes to that. Lack of love, lack of compassion, lack of support. So you're lacking the sweetness in your life. And yes, I know our time is getting short. We're lacking sweetness in the life is what they teach. As far as the other part, I haven't heard it specifically connected to Candida. I have heard it connected to other conditions, but not Candida.
Okay. And then
that's
the
a good
third thing
question.
is,
Thank you.
The third thing I want to address is structured water. I don't know if you're aware of the structured water systems.
Yes, I am, and all I can say is that I don't see anything wrong with it. Let's put it that way with the research I've done, but I haven't done a lot of in-depth research, just enough that I know that I didn't see anything that put up red flags. Let's put it that way.
When I take a structured shower, I get hydrated completely within 7 minutes.
Right. No, I don't see anything negative about it, if that's basically what you're asking. Thank you.
No, I mean, it's very
okay, let's
positive.
go.
Yeah, okay. Thank you very much.
Okay, go ahead, Tracee. You're welcome.
Okay, Trudy.
Yeah, I just wanted to say that when I was trying to get rid of Candida before, this was when I was younger, I found a recipe and I took that along with changing my diet, but it was bentonite clay, aloe, psyllium husk, and chlorophyll. And I made a drink of every morning, and I would drink that along with afterwards water and such. But that really helped a lot because it really got things off the walls of your intestines and such, you know. And really,
that's a good formula. I've heard that.
Can you send the exact recipe?
Yeah,
to me, Trudy?
I can't find the exact measurements for that. That's why I was like, if anybody else knows about
Trudy,
this,
Trudy, let me comment on that. It's a good formula because I've heard it. But again, bentonite clay can constipate you. Remember that. It's clay.
Right.
And so if you're not
you don't need much of that.
You've got to be careful. No, and chlorophyll is a blood purifier as well. So you're fine with chlorophyll in most cases, but it can also cause Herxheimer reactions if you go too fast. So there again, it's not a good recipe for just anybody, because you have to know, are they eliminating? Are they drinking enough water? There's another one that includes diatomaceous earth, and that scares the hell out of me. Do you know why? Tracee,
oh yeah, that was too much. Yeah.
Okay. No. Because diatomaceous earth is spread around I used to spread it around my farmhouse, for instance, to get the insects away, right? The insects eat it, and it's got like sharp pieces, just like sharp pieces of glass, and they die. They bleed internally. People are putting that in from the internet, right, Trudy? They're putting it in from the internet where they get all these recipes, and they're playing doctor. They're actually causing leaky gut.
Yeah.
Because they're poking all the delicate tissues. Yeah, but what she's saying does not have that danger. The danger that she's potentially could have in that recipe is the constipation, not the danger of something like don't ever use diatomaceous earth in your body. It is strictly for for outdoors, for farms and insects and all that, not to be taken internally. Okay,
that's good to know.
I did this. I did this for a while, and it was small amounts, you know. So, but it helped with herxing.
Yeah, no,
such, you know.
Yes, yeah. Thank you for sharing that.
I'm fine on time, Dr. G. And if you aren't, then if you need to go, you can go. But
no, I'm fine on time because Thursday afternoons is for all of you, so I don't have any patience. I booked off every Thursday afternoon. Go ahead.
Okay, last question from Paul.
Go ahead and ask.
It says Paul.
Well, this is Paul's wife, June.
Hi, June.
Hi. And we've, one of the tests that they don't do when you get married is for Candida. They do test for sexually transmitted diseases, but they don't test for that. So we have entertained Candida for 48 years. And we're both on antifungals. We take ketoconazole and Lamisil, and we alternate that every other day. And that is basically, along with all the dietary things that you've talked about, how we keep it at bay. And I hate these drugs. And we use a...
You should.
I know. My background is 40 years in dentistry, so I did take organic biochemistry, and I understand the dangers. We use a pH-balanced water machine, And I was wondering if you were familiar with Dr. Robert Young's book, The pH Factor.
Yes.
And he
Yes, of
recommends
course.
he recommends chlorine dioxide, and we also put that because we have tested our machine, and it says that it will give us water that's 9.5. However, I've never been able to get it to 9.5, but with the drops, the chlorine dioxide drops, it does a much better job. His book is called The pH Factor. The other thing that I used for 2 years, I did a AM coffee enema, and I drank Podiarco tea. And if I couldn't drink the tea and we were traveling, I took the capsules. And that seemed to help with consistent elimination. As you mentioned, it's so important when you're taking all these different things and attempting to keep it flushed out of you, that you keep that flow moving effectively so you don't get sick.
Okay, and that's those are great points, but let me bring something else out.
Okay.
You are on the right track, and I love what you're doing because of your routine, but you're not getting to the root of it. And I really believe that if you tried the caprylic acid, you might find that you will get ahead of it. As long as your diet, you're doing everything else right from what you're telling me. So again, it's the only thing I've ever found. I can't recommend that, but I can tell you I've used it. I had one of the worst cases of Candida, and it worked. It works on my patients, but most of the time with the drugs, as you correctly stated, they're causing other side effects, and you don't want to be on the drugs, but on the other hand, you don't want to go through what you're going through with the symptoms of Candida, and it's transmitted back and forth. Any body fluid that is exchanged is exchanging the Candida as well. And that's the scary part, because you mentioned, was it you that mentioned that when you get the marriage license, they don't make you test the for Candida? Well, they don't even know how to test it. That's why they don't. If they did, we'd have some other issues to deal with. But alcoholics all have it. Why? Because of the alcohol and the beer and the fermentation of the grains. They all have it. I have never, ever worked with a alcoholic in 40 some years that didn't have excessive Candida. And that's why a lot of the emotional mood swings and depression and all that goes along. So you're on the right track, but just work on getting it totally where it's just a normal amount in the body, which is not very much in there, and being able to slowly get off of your drugs if you choose to by using something natural, like something made from coconut. Does that help?
Yes. And honestly, it was about, you mentioned stress earlier. I cannot tell you how significant that can be, because I was able to be off the drugs for 3 years. And such a happy person. People would come up to me and that knew me and said, "You're glowing. What is going on?" Well, I wasn't on the drugs. And then there was a year of stress. It was, I didn't really care if I lived or died, and that brought it back. So
absolutely. And it's blood sugar's the same way.
Yes.
Yeah.
Stress
I'm
is
type 2
horrible.
diabetic, and I had I had it under control until COVID hit. I got COVID, ended up with a severe concussion because I fell. And then my partner ended up with kidney dialysis. I mean, come on, that's stress. You know what that's like. So Tracee, go ahead.
Well, stress produces cortisol. Okay. And when a patient has like a transplant, like an organ transplant, they are given a cortisol mimicking drug so that essentially it reduces their immune system so they don't reject the organ. So that tells you how powerful cortisol is in a bad way, right? It totally decreases your immune system, which means you're like an open, source of it. You can get anything. And so stress is really, really important. So that's why I covered that. But let me really quickly, before people leave, is your homework is to do a test. Do one of the saliva tests, and that is your homework. You can read the test. I will actually post that slide, that picture, to show you what it is, so that people can be reminded that if it's floating, you're in a healthy range. If you have the legs coming down, that is, unhealthy. And then if it's sinking, that's really bad. Okay. So I just want to make sure I add that in.
And take a picture. Yeah. Take a picture for yourself. You don't have to show it to anybody else. Take a picture and date it so that you can compare, because the only way you know if you're making progress is to have the visual proof.
Good idea.
So definitely take pictures. Yeah.
Okay. Thank you.
You're going to post
Debbie.
that then. Is there any other questions?
One more, Debbie.
Where's Debbie?
In the upper left corner. Upper left corner.
I see her. Okay. Hi, Debbie. Yeah. Hi, Debbie. Go ahead, hon. You have to unmute yourself.
Here, I just clicked ask to unmute, and there you go.
Okay.
So
go ahead, Debbie.
Yeah. I saw a doctor in the mid-90s who did a complete overhaul of my gut. Looked at the stool, saw there were more bad bacteria than good, did all of this stuff. And then in 2002, I contracted H. pylori and almost died. So, because I bled out with a GI bleed. So then fast forward, I started on this probiotic regimen that, because unfortunately also developed localized amyloidosis. And with the light chain protein, and started doing that and really hit that gut health and learned about the connection between the brain and the gut and, the axis, and was able to bring those light chains, down the kappa. My question is, do the probiotics help to combat the Candida at all?
I'm glad you said that, because I didn't deal with probiotics. Yes, because the probiotics are a good bacteria. It's your good army. It's not the enemy. It's your good warriors. Okay. However, if you buy a probiotic over the counter or buy from one of these ads and they're not refrigerated, it is not live bacteria. It's not going to multiply in your gut. If it's shelf stable, don't waste your money. If it's a high potency, the only ones that I use with my patients are anywhere from 60 billion organisms in one capsule all the way to 100 billion. You're shaking your head. Is that what you take? But it has to be that high. And it's just in a capsule. You only take one a day. But if you're buying, I have a lot of people that say, oh yeah, I found her at the health food store and they were on sale. I bought a couple bottles. I said, were they in the refrigerator? No, but it says it's got, 2 billion. Well, hello, we give newborns 2 billion. As an adult, you've got to have more than 50 billion, 50, in order to be effective. And it has to be refrigerated. It needs to be live bacteria. So yes, thank you for saying that. And one other thing, Debbie, we talked about, I think Tracee talked about prebiotics. Somebody talked about prebiotics. Remember that prebiotics are food for the gut. It was Darlene that was talking about prebiotics. And prebiotics are the food, okay, for the probiotics. So again, if you're not eating a lot of the, the vegetables that have all of the fiber in them, you're not feeding the good bacteria. So yes, you'll get some benefit, but then it won't continue to multiply. Just think of that Tinker Toy example. Same thing with your good bacteria. You want it to keep multiplying. It won't do that if you don't feed it. And what feeds it is prebiotics. Okay, and the food for the probiotic.
My favorite prebiotic is psyllium husk. Somebody asked about that in the chat a little bit ago, and I use psyllium husk. It's like it has just one ingredient. There's nothing added to it. It's like slippery. So if it gets wet on the counter, so I feel like it's scrubbing bubbles in your gut, right? Like it just slips things and gets things out.
Yeah, I also use.
Well, it does. And remember, do you use slippery elm as well, Tracee?
Yep.
You know, I do, but I only put it in smoothies because it doesn't mix well if I'm just using like a glass of water.
Right. But if a person is having trouble with the fiber, let's say you need the fiber, your elimination is a little sluggish, and then you add the psyllium, you could get constipated. If that happens, try some slippery elm. You can buy it in bulk, put it in some capsules. That's what I had to do. But you can buy them now encapsulated. When I started, you couldn't. Don't stop taking the psyllium, like Tracee said, because it's great prebiotic. But if you have a problem eliminating, remember, they're very inexpensive. Buy some capsules of slippery elm and take it that way. And that way you'll have, like she was saying, you'll have the scrubbing bubbles of the fiber, but you'll also have the slippery elm to help it slip through.
Right.
Yeah. Okay. Thanks, Debbie. That's great.
Oh, okay.
Do you have one more question, Debbie?
Oh, I was just gonna say, I have horses, and if they ever get a bout of diarrhea, we use slippery elm, and we also use an anti-parasite because it doesn't allow the.
Wow, I didn't know about that with the horses. Yeah.
So I've used it for
so what happens? Does it? Okay, so does it stop the diarrhea on the horses? I've never heard of that. That's great to know.
It helps to soothe it.
It does. Okay.
Yeah, and then it doesn't allow the parasite to catch.
Oh, okay, gotcha. Yes, that I knew, but I didn't know about using it that way. That's great, because I used to have a lot of farmers that came to me for those type of things, and I had to be very careful because I'm not a vet as to what I could say, but I could say, well, in people it works. It should work in your horse or in your dog or whatever. So, and your goats, I had to be very careful. So most of the time we use homeopathics, which is fine, but once in a while I'd have to go out of my lane a little bit to help a patient. So thanks, Debbie. That was great information.
Thank you.
Yeah, I actually use it on my dog every single day. She has a lot of gut inflammation, and if she doesn't get it regularly, has alternating constipation and diarrhea, and she gets a lot of like irritated, like a lot of inflammation in her belly. So I give it to her every single day, and she's regular, and she seems to be much more comfortable. So,
is this the adorable poodle that I see you with?
My baby. Yeah. My little girl.
Okay. Your baby. Okay.
Okay. One more question.
Let's take one more.
One more. Rich.
Can you hear me?
Yep.
Okay. Yeah.
Yes.
I just want to know if you heard of Dr. O'Hara's probiotic, where he uses
yes, I have.
Pre-pro and postbiotics, and it's fermented. What's your opinion of that system?
Yes. I can't give you a legal opinion on that. Sorry. Ethically, I can't, because that's talking about somebody else's product.
Well, let me ask you about postbiotics.
Sorry, but I can't do that.
How about postbiotics?
Postbiotics?
Fermented.
Postbiotics, if they're fermented, are usually very good.
Okay. All right.
Yes. Okay. It's like somebody asked me the other day, well, I saw these two products and which one would you take? I can't do that ethically or legally, because that's competing one product against another. I can tell you which product that I like the best in something, but I can't give you opinions on that. So thanks for understanding that.
So
okay, any other questions? Did you get a lot of
pre and postbiotics with the probiotic is more complete then, is that correct?
Wow. Depending on your health issues, yes.
Right. Like apple cider
mostly
vinegar.
Mostly it would be good, but I can't tell you that.
Isn't
yeah,
ACV,
so you're asking me to give you advice, and I can't do that.
Well, is ACV a postbiotic?
Is it a what?
Is apple cider vinegar a postbiotic?
No, not as far as I'm concerned.
Okay.
It alkalizes you, but it's not a postbiotic. No.
Okay.
Thank you. Those are good questions.
Okay. All right, you guys, let's wrap it up. So first of all, thank you so much, Dr. Gloria, for your wonderful information and help for all of our lovely members. Thank you all for coming and participating, asking questions, and being engaged. Please don't forget to do your homework assignment of testing yourself, because we want you to be at the top of your game. Post QARC, you guys, we have a lot of work to do. And I know that most of you here are going to be rolling up your sleeves and digging in. And it's so exciting to partner with all of you. And I just appreciate you so much for really wanting to improve yourselves. And we're all in this together. So sending you so much love and joy and gratitude. Do you want to say?
I hope you all learned something. Did I teach you something you didn't know? Did you all learn something you didn't know?
Yes.
That's my goal. At least if you learned one thing you didn't know. Okay. Good,
awesome.
Good.
All right,
Tracee,
you guys.
Thank you. You're a great host. Thank you.
Thank you. We'll see you all next week. The topic is TBD. So I'll let you guys know as soon as I have it confirmed. Okay. Have a beautiful day, you guys. Thank you.
Thank you, Tracee.
Thank you, everybody.
Thank you so much.
Thank you, guys.
Thank you, Dr. Gloria.
Love you guys.
Stay safe.
Love you back,
Love
Michelle.
everybody.
Love you guys. Bye-bye.
Bye-bye.
Bye-bye.